So we are discussing the submandibular gland. Submandibular gland is walnut shape, whether its superficial part is walnut shape. It lies below the submandibular, below the mandible, so called as submandibular gland. Rather, there is a submandibular fossa in the submandibular gland below the mylohyoid line. So now here there are two sections drawn. This is the transverse section, anterior, posterior, lateral, medial. So here we see the submandibular gland. The superficial part is superficial to mylohyoid, and deep part is deep to mylohyoid but superficial to hyoglossus. From the deep part arises the duct. Ahead here is the sublingual gland, which is almond shaped, which doesn't have a duct. It has 15 ducts, single duct nahi hai. All those ducts open on the sublingual folds, while at the corners of the sublingual fold, the submandibular duct opens. Now here is the superficial part I have drawn for you. This is the coronal section. This is medial, this is lateral, this is inferior, this is superior. This is the mylohyoid line. From there is mylohyoid, which lies on the medial side. On the lateral side is mandible and facial artery on the inferior surface. So there is medial surface, lateral surface, inferior. Inferior surface is skin, superficial fascia containing platysma, containing the cervical branch of the facial nerve, okay, and facial vein. So that's the relation of the superficial part. Now the deep part. This diagram, we have removed the superficial part, we have removed the mylohyoid, we have cut off the superficial part. So small deep part is seen lying on the hyoglossus muscle. So this square is hyoglossus, this is styloglossus. Deep part, superficial relation is mylohyoid, deep relation is hyoglossus. Superior relation is lingual nerve, chorda tympani joining the lingual, it is carrying the fibers, right, for the secretomotor fibers for both these glands. We release the fibers in the submandibular ganglion, which gives it to submandibular gland and sublingual gland. So postganglionic fibers are short, preganglionic fibers are long in case of parasympathetic ganglion. Lower down here is the hypoglossal nerve. Lower down here is hypoglossal nerve. Now coming to the nerve supply of this gland, the parasympathetic supply comes from superior salivatory nucleus. From there via nervus intermedius, which joins the motor root of facial to form the facial nerve. Fibers are now in the facial nerve. Facial nerve gives a branch called as chorda tympani. This chorda tympani joins lingual nerve, which is branch of mandibular. This lingual now gives the fibers to the submandibular ganglion, and then fibers go to the submandibular gland. This is the parasympathetic fiber. Sympathetic fibers come from the sympathetic plexus around the facial artery. The sensory fibers come from the lingual. Now applied anatomy, sometimes stones are formed in this duct submandibular gland of the submandibular gland, and we do xylography to check the patency of this duct. Thank you.